Ancient Rome, renowned for its military prowess and organizational skills, also had a sophisticated approach to battlefield medicine. Roman combat medics, known as Medici or Medici Legionis, played a crucial role in treating wounded soldiers on the front lines. Their methods and practices were surprisingly advanced for the time, showcasing the Romans' commitment to the well-being of their troops. One of the key advancements in Roman battlefield medicine was the establishment of military hospitals, known as valetudinaria. These hospitals were strategically placed near battlefields to provide immediate care to injured soldiers. Here, Medici treated various injuries ranging from minor wounds to more severe trauma sustained in combat. The Medici were skilled in basic surgical procedures such as wound cleaning, bandaging, and amputation when necessary. They also employed various herbs, ointments, and poultices for treating wounds and controlling infections. Additionally, they used techniques like cauterization to stop bleeding and prevent further complications. In terms of medical equipment, Roman combat medics had access to a range of tools, including scalpels, forceps, and probes, which they used for surgical procedures and wound treatment. They also utilized basic medical instruments, such as splints for bone fractures and traction devices for limb injuries. Roman Medici were also well-versed in the management of battlefield injuries such as fractures, dislocations, and head trauma. They understood the importance of stabilizing patients before transport and utilized improvised stretchers and carts to evacuate the wounded from the battlefield to the valetudinaria or field hospitals. Make sure to subscribe and press the bell icon. Moreover, Roman military physicians, known as medicus castrensis, provided leadership and supervision to the Medici, ensuring that medical practices were standardized and effective. These physicians received formal training in anatomy, surgery, and pharmacology, enabling them to oversee medical operations with competence and skill. Despite their advancements, Roman combat medics faced numerous challenges, including limited resources and the constant threat of infection. However, their dedication to saving lives and mitigating suffering on the battlefield contributed significantly to the overall effectiveness of the Roman army. Ancient Rome's combat medics demonstrated a level of sophistication and proficiency in battlefield medicine that was remarkable for their time. Through their skills, knowledge, and commitment to duty, they played a crucial role in sustaining the health and combat readiness of the Roman military forces.